Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's now understand the psoriasis and we'll focus on the treatment ladder for psoriasis. So, treatment ladder. So, under the treatment ladder, the first one is in case of mild psoriasis without arthritis. So, there is nothing but mild psoriasis. And this will be without the arthritis. So mild psoriasis without arthritis. So we have something known as the first line. So under the first line, in case of mild psoriasis without the arthritis, the first line includes the coal tar. So coal tar. Next comes the dithrenol. So you have the coal tar, you have the dithrenol. Next, there is also the potent topical steroid. So there's a potent topical steroid as well as the vitamin D analogs. So this was the first one, coal tar, dithrenol, potent topical steroid as well as the vitamin D analogs. Next we move on to the second line. So this was the mild psoriasis without arthritis. So the second variety or the second line. So here in the second line, it includes the local NB-UVB. So this includes the local NB-UVB or the PUVA. And it also includes the excimer laser. Next is we move on to the moderate or the severe psoriasis. So next category is a moderate or severe psoriasis. So the moderate or severe psoriasis, and this is without again the arthritis. So this is again without the arthritis. So here there is the first and the second line and the third line as well. So as per the first line, it will be the NB-UVB and the PUVA and or the PUVA. This is the first line. Now, as we move on to the second line, so second line, it includes the acitretin, apremilast, as well as the cyclosporin and the fumaric acid. So you also have the cyclosporin. Next you have the fumaric acid. Fumaric acid esters wherever available as well as the methotrexate. So the first line was NB, UVB and the PUVA. Next was the acitretin, the apremilast, the cyclosporin and the fumaric acid and the methotrexate. Lastly, the third line, this includes the adalimumab as well as the etanercept, adalimumab, etanercept, infliximab. Next, there is also the secukinumab and the ustekinumab. So this was about the third line. Lastly, we move on to the third variety. The third variety is where you have a moderate or severe psoriasis, and this is with the psoriatic arthritis. So since it has the psoriatic arthritis, so the first line will be to start directly with the apremilast. So you have apremilast. And the second variety would be to start with the MTX, that is a methotrexate. Now, how is the second line? Going by the second line, it is adalimumab. As well as etanercept. There is also the infliximab and the ustekinumab. So all this comes the second line. So what about the third line therapy? The third line is nothing but you go for combination therapy. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.